everyone, this is Bushra Khan. Welcome to RNN Podcast. Today we have a very special guest as a chief guest to give counseling sessions to other doctors who are locally working in Pakistan. When I talk about who is he, he's actually Dr. Yasir Javed, who is specialist in trust cardiology doctor and has been serving and practicing in British for last 25 years. But the point of inviting him here as a guest in the podcast of RNN is to get to know about how and why so many ratio is increasing day by day when we talk about the young generation, the young lot receiving heart attacks day by day. Every other day you are hearing such news which is quite out of the blue, but now here we got a few certain concerns which we can actually, he is going to answer us. And also we would like to know about the chest diseases, heart attacks, symptoms before heart attack, and how can you evaluate and analyze if you are randomly at some stage of your life in a split second receiving a heart attack. So how would you evaluate? Let's just find out. Assalamu alaikum.
Walaikum salam.
Good evening.
Good evening.
Welcome to the RNN podcast. First of all, thank you for taking out your precious time here, because I know your time is really precious and you're just here direct to attend a few conferences, give counseling sessions to the practicing doctors who are already working here in Pakistan, especially when we talk about cardiovascular diseases and diabetes. So, Dr. Yasir Javed, cut to the chase. I would like to ask you one of the my first important question of the day and of the podcast. Being here, attending the conferences based on cardiovascular diseases and diabetes, what kind of a difference have you seen in the health system of Pakistan and British?
I think there are two very distinct healthcare systems. In England, we have the National Health Service, where it's essentially free at the point of care. So it doesn't matter where you live in the country, what your income is, everyone gets the same basic standard of care that's free at the point of care. Whereas in Pakistan, I think it's a little bit more disjointed and perhaps affordability may come into the equation in terms of what quality of care you may receive.
So here you're using the term quality. So we agree to the point that there is something lack of quality in Pakistan's health system as well, which is coming even from ages, and we cannot. We are just making sure that we could, bring some improvement to the health system in other years in future, but surely there is something which is keeping us as a glitch, and there is a glitch in the system. But sir, Dr. Yasir Javed, just tell us why there are so many heart conditions and heart diseases brimming up, and why there is a rate and ratio increasing day by day in young generation, young lot.
Yeah, I mean, this is a common phenomenon actually across the world. We know that, firstly, cardiovascular disease, which is essentially a combination of having a heart attack or a stroke, is on the increase. It's the world's biggest global killer. So it's not just a problem in Pakistan. But we do know that a Pakistani population may have specific genetics that may actually enhance that risk. And one of the biggest risk factors also is type 2 diabetes. Type 2 diabetes is, I would say, like pouring petrol on the fire of cardiovascular
Acts as a
disease.
catalyst.
It's a huge catalyst. Not only do patients with type 2 diabetes get heart attacks much earlier, but their heart attacks are actually more devastating. They can be more dangerous,
and not easily could be managed or handled.
But type 2 diabetes is a global pandemic. It's not, it's on the increase throughout the world, driven by sedentary lifestyles, visceral obesity. By visceral obesity, I mean obesity around the belly. That's the dangerous type of fat that accelerates this whole process.
All right, and it accelerates. There is one major factor. You're talking about genetics and then diabetes. But what if there's a person who has no such history of genetics, heart attack and genetics, and also diabetes, but he or she faces heart attack? Then how can we say and how can we evaluate that what's the root cause?
So, genetics play a role, whether you get type 2 diabetes, but there are a whole host of other risk factors. Being male is a risk factor. Men get heart attacks much earlier than women in younger age groups. Ethnicity. So I come from England, and certainly we know patients of South Asian ethnicity are at much higher risk. Bangladesh, Pakistan, India, ethnicity, these definitely accelerate your cause. We don't know. I mean, it's multi-genetic factorial, but a lot of it could be due to, again, your predisposition to putting on fat around your belly and your risk of getting type 2 diabetes.
You talk about belly. So by belly, you mean that your gut system and your gut, the whole system of your gut has to be kept in a well-managed
Yeah,
formation. It means that it is also related to your food, to your diet, to your habits, and every other thing. Because
absolutely.
if you keep your gut strong and healthy, it definitely decreases the risks to have heart diseases at earlier age, and even not at an earlier age, but also later on. Is that true?
That is absolutely true. So lifestyle plays a big role. So most conditions in medicine are an interplay between genetics and lifestyle. So
All
you've got to have
right.
the genetic predisposition that loads the gun, and the lifestyle pulls the trigger. So you've got to have both. And by poor lifestyle, it's not just diet; it's lack of exercise,
All right.
sedentary lifestyle. But in terms of the diet, particularly in South Asians, they tend to have diets that are very rich in refined carbohydrates. And really, it's the carbohydrates that probably do most of the damage in terms of this abdominal fat accumulation. So it's the bread, rice, potato, sugar, pasta. If you eat
Yes,
these in
yes.
excess, which is
True.
quite common in an Asian
True,
diet,
true.
it does get accumulated as this dangerous, very dangerous visceral fat, we call it. And that's what can really accelerate your furring up of your artery.
You never know you get heart attack, right?
A lot of patients get no warning. They're blissfully unaware that their arteries are being furred up until one day, one fine day, one of the blockages in their arteries can just rupture. And when
One
that
day.
blockage ruptures, it can form a blood clot immediately. And that can block an artery to the heart, and you can get an immediate heart attack
Right.
without any warning.
So, how can we cope up with such situation? Or let's just get to the lifestyle first.
Hmm.
That how to keep a lifestyle healthy, where you can avoid such diseases.
I mean, it's not rocket science, but we need to make sure that patients are being very active, exercise. There's no drug treatment that can replace the virtues of healthy living.
All
You know,
right.
no drug that you can get from your doctor can replace those benefits. So being as active as possible, preferably also incorporating some high intensity exercise, as well as resistance training, we know is very good for cardiometabolic health, we call it.
True.
Smoking cessation is absolutely key. We know that cigarette smoke contains lots and lots of chemicals that speed up the furring up of your arteries. We've talked about healthy diet. Portion control as well. I think South Asians, in my experience, I can even speak for myself. I'm of South Asian ethnicity. We do tend to overeat. Portion control maybe could be
At
improved
times, yeah.
at times. Yeah, so those would be the main things, and maintaining a normal weight.
Healthy lifestyle. Living
Healthy
a
diet.
simple life.
Simple life, eat in moderation.
Not so fancy foods every other day.
Yeah, everything in moderation, and try and burn it off with exercise.
True, true, true. So, doctor, suggest us if someone is in depression or stress, can that depression or stress lead to heart attack?
That's a really good question. We know that patients who have a history of depression and stress are at increased risk, but we don't know whether it's the depression or stress, or the fact that people who are depressed and stressed tend to have
both are
poor
interrelated.
lifestyles,
Yes.
and they don't perhaps exercise as much. Perhaps a lot of people who are stressed smoke too much, drink too much, eat too much. But there are other risk factors that we probably should talk about: blood pressure, cholesterol, kidney problems, and diabetes. They all play a role in terms of potentially accelerating your risk of having early heart attacks.
So, how can you control diabetes?
The best way to control diabetes is to prevent yourself getting it. So the best way to prevent yourself getting diabetes is exactly all the lifestyle measures that we talked about: maintaining a healthy weight and lots of exercise, and really reining in those refined carbohydrates.
All right. And for example, sometimes obesity and overweight also leads to heart problems,
Yeah.
high blood pressure. And as you said earlier, is that possible? A woman or a man can actually control his or her weight at any stage of life to get rid of these problems. High blood pressure. Can high blood pressure be controlled?
It can. I mean, high blood pressure is very much related to genetics as well, but a lot of it is related to weight, excess weight. So we know that significant weight loss can actually normalize your blood pressure. And it is really important to check your blood pressure, because you cannot feel whether your blood pressure is high or not. And you can get machines that are very cost effective. I encourage all of my patients to just buy these machines and just every now and then check their blood pressure at home and make sure that it's not elevated at that sort of dangerous level, something over 140 systolic blood pressure, you really should be getting that checked out by your doctor.
There are certain queries when we talk about symptoms of heart attack. There's a research which says before you have heart attack, you might go through such symptoms which leads to heart attack. How can you evaluate or how can you pinpoint those symptoms?
Can be difficult, but most patients who have a heart attack generally get some sort of discomfort. I won't necessarily call it pain. It's often a tightness. It's not something sharp that
Shortness of breath?
You can get short of breath, but it's usually a tightness, a heaviness. Some patients will describe it as if someone's sitting on their chest, and it's usually
Squeezing
diffuse.
it or
Squeezing is a good terminology sometimes patients use, but it's not like a knife going in. If someone says, I've got a very sharp pain and they can point to it,
all right.
unlikely to be cardiac
right.
pain. This is a diffuse pain, and it can go down the left arm. It can radiate to the jaws as well. But the key thing is patients generally feel unwell. They're often sweaty, clammy, feel a bit nauseous. Any symptoms like that.
Panting, walking upstairs, downstairs, or having a neck pain, maybe? Could be?
It can radiate to the neck, both sides of the neck as well. So it's different location in different patients, but it's usually that sort of squeezing nature, and patients will be unwell. You're not going to see a patient with chest pain who looks very well having a heart attack. That's going to be very unlikely. They usually look unwell as well.
All right. Does it start a day before, few hours before, a week before, or it could start any time?
If it's a true heart attack and you're having that heart attack, the pain will come on suddenly. But some patients can get sort of pains related to blockages in their arteries, maybe several days before their heart attack, or worsening pain before they have their big heart attack.
All right. So now, when you know you're having a heart attack, what's the first thing you can do to control or to avoid or to cease the pain?
If you're having a true heart attack, then there's no alternative. You must seek urgent emergency medical attention. So in the UK, we would encourage all patients to dial telephone number. In our country, it's 999, and you get the ambulance in, because basically these patients need to be treated in a heart attack center. Generally, they'll get a stent, open up the blockage. There's nothing you can do to open up that blockage yourself. You could, while you're waiting for the ambulance, take some aspirin. That can sort of help.
Aspirin under the tongue?
Or just crush the aspirin and swallow the aspirin is probably the best bet. And that can sometimes help it won't dissolve the clot, but can help minimize the clot.
All right, but now there's a question. For example, you're having a heart attack.
Mm-hmm.
Do you naturally get that time where you can actually help yourself in dialing it to the doctors or waiting for the ambulance, or you could do something to cease the pain? Do you think there is that much time where you can actually do something when you're having heart attack?
Yeah, I mean, believe it or not, some people can have a heart attack and it feels like they've just got a bit of indigestion. It doesn't have to be a severe, crippling, disabling pain.
There's a few certain percentage who are actually lucky to survive after first heart attack and even second and then third. There are certain cases, but there are also those cases where we have seen direct death after just going through first heart attack, maybe a heart attack.
Depends where the heart attack is, which part of the artery is blocked. If it's in a big artery that's supplying a big part of the heart, then unfortunately it can be fatal in those patients. But I think most people would survive their first heart attack if they are brought to urgent medical attention quickly.
So, for example, there is an actress, Shishmita Sen, who had heart attack back in February 2024. But now she's surviving, and she is a survivor. But she has been enough lucky to survive through that heart attack. Otherwise, you see that people just directly have a silent heart attack, and we are unable to see them again. So when you have a silent heart attack and you are a patient of diabetes, how can you know that silent heart attack could hit you one day?
It's hard to know because the symptoms can be very vague. The main message I would like to get out is if you feel as though you have anything that could be related to a heart attack, you mustn't delay and you must go and seek urgent medical attention. There's nothing you can do to treat that heart attack, to improve your prognosis beyond getting to urgent specialist care.
All right. So what do you suggest to the young generation? how they can maintain their healthy lifestyle to avoid such diseases, even if they have in their genetics, or even if they have history in their family of heart attack, or if not.
I mean, heart attacks are so common, particularly in this country. It would be very uncommon for someone not to have a family history of heart attacks. So what we want to identify are those patients who have a family history of early heart attacks. So if anyone in your family, especially first-degree family, has had a heart attack or a stroke, it's the same process, below the age of 55 in a man or 65 in a woman, then I think you should be proactive and ask your family doctor. I'm sure they can have access to these tests to check things, common things like blood pressure, cholesterol profile, make sure you haven't developed early diabetes. And if you have that type of family history, it just means you have to be even more strict on your diet
Conscious
and lifestyle.
about it, right?
You have to work even harder.
Vigilant.
Because you've probably got genetics that are working against you.
Yes.
Yeah.
Any stage of your life, and you never know about it.
Yes.
It can hit you any part of the day. And since you're talking about the tests, that you have to check your BP every other day, or maybe once a week or twice a week, is there any other test as well you can actually do?
So blood pressure, the best way to check your blood pressure is actually twice a day for a week, and then every 6 months. So I don't want people to check their blood pressure every day.
Every other day they would be
just
start
for 1
checking
week,
up.
check it twice a day. That's the recommendation. And if it's fine, then do that every 6 months. If you've got that type of family history, you need a blood test to check your cholesterol profile. There's quite a few parameters you need to check, but your doctor should know which tests to do. Some people are genetically predisposed to have a high level of something called LDL cholesterol. And this is very dangerous cholesterol if it's high, because that will also accelerate the furring up of your arteries.
All right. And those who have a paunch,
Yeah.
does it lead to heart attack?
It's a big risk factor.
So
Even
please
if you're
tell
a
to the
norm-
audience that this is the biggest factor.
Even if you've got a normal weight, believe it or not. So some people use a very crude metric called a body mass index, which is not a bad metric, but for South Asians, I don't think it's sufficient, because a lot of South Asians actually are not technically overweight, but they do have a lot of fat distributed around their abdomen.
Right.
And that fat surrounds your liver, your pancreas, your kidney, your heart. And
Your
as I
gut.
said, that is a very dangerous fat. It's
Yeah.
completely different to fat under your skin,
True.
on your hips and thighs, and it can really accelerate cardiovascular disease risk.
True. So in every other statement, you pinpointed South Asian society, where there is high risk of having heart attacks every other day. And it's increasing, and we can't deny the fact as well. And you are also here to attend the conferences and also give counseling sessions, representing as a British Pakistani doctor.
Yes.
But I would like to know about the Western society as well. Do they face such issues? Is there any increasing percentage of heart attacks in Western society as well, or not?
It is, but perhaps not to the same degree. But certainly we see patients of white ethnicity getting heart attacks in their 30s and 40s. It's less frequent, but it can happen because anybody can have genetics that predispose them to early.
But why? And how's that possible? What's so special in their diet or in their lifestyle which we lack? I would rather ask.
I think Western society is getting just as unhealthy in some instances.
Yeah,
I've seen it
true.
around
On the
road.
other side, yeah.
I think a lot of societies are getting less active. A lot of us are spending more time in the
Lazing
office.
around,
COVID has now meant a lot of people are working from home. They're perhaps not doing as much exercise.
sitting on couch for next 24 hours, working from
Absolutely.
home.
Absolutely. And then also when you're working from home, you tend to eat more. You're near a fridge. So the lifestyle it's really the lifestyle
Has
that
turned upside down.
turned upside
But
down.
no, here my question was that how the risk of having heart attack in 30s or 40s in Western society is lower than Asian society.
It's genetics, and we can't explain that. So we just know that Asian societies tend to have genetics that predispose them to more diabetes, more abdominal fat.
Because of the health or the lifestyle or the food intake.
No, genetics are just something that's part of you. You can't change
You
that.
can't change it,
can't
and you
change
can't-
that. It's just part of your makeup.
All right,
Unfortunately,
all
I
right.
wish we could. I wish you could exercise away bad genetics, but you can't.
All right. Before we wrap up the conversation, I would like to know about your experience being in Pakistan and attending the Lahore's conference today. And also, you're traveling to Peshawar and then Karachi and then Islamabad. How do you feel about it? How's your experience? What did you perceive out from the conference? And what did you analyzed about the information the doctors have about heart attack? Or what would
Well,
you
firstly,
say? It's a critical question. But
yeah,
yeah.
no, I mean, firstly, it's a huge pleasure to come back to essentially, I mean, I was born in London, but I always consider Pakistan to be my sort of home country. So it was a nice experience there. And I was very pleasantly surprised, actually, at the level of expertise of your local clinicians. But I think they're just perhaps a little bit overwhelmed by the quantity of patients with these risk factors. But I've got no concerns whatsoever about the level of knowledge and quality of care that they are delivering for their patients.
So you think they lack? They're lagging behind?
No, they're not. I was very impressed by the quality of their
All
care.
right, you're impressed by the
Yeah.
quality. So
Yeah.
what would you say, what your expertise says, is there anything room for improvement or something we should add in our health system?
I mean, that's a political question. I think it's all about resource. And I think the more you resource and fund the treatments, a lot of the treatments that we're talking about for diabetes, cardiovascular disease, lowering your cholesterol, they're very expensive. We're fortunate in the NHS in the UK healthcare system that the government subsidises and funds that treatment. That's probably the major difference.
And we're lagging behind here in
Yeah, I think
Pakistan.
from what I can gather, a lot of patients have to pay for their own treatments, and if they
Huge sums
it
of money, yes.
it becomes an affordability issue.
True. Let's see.
So irrespective, a doctor can be the best doctor in the world, but if the patient can't afford the treatment
Yeah,
they
and
prescribe,
it's
there
not
is
even
going
in
to
the
be an
hands
issue.
of doctor.
Yeah.
Eventually, you have to deal with the consequences as well.
Yeah.
Let's see. We are looking forward towards that prosperity when we see through our eyes the development and bright future of Pakistan in terms of reformation in the health system, and especially when we meet doctors like you from British. We wish that one day we do have such expert doctors in Pakistan. And
You have expert doctors.
yeah.
I don't think that's the issue. You definitely have very expert doctors in Pakistan. It's perhaps the way the healthcare is funded that makes the difference.
let's see. But yeah, you're right. I won't add any comment in it. But yes. Anyways, thank you, Dr. Yasir Javed, for being here, taking out your precious time. Thank you guys for watching us today. Just stay tuned to RNN podcast. Stay tuned till we get back to you in another session. But yes, if you guys have any queries, if you guys want to ask any question regarding heart condition, heart problems, heart attack, please let us know frankly in the comment section below or down. Till then, bye-bye.